You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have an expert on this topic, board-certified in implant dentistry, Dr. Matthew Holtan. Dr. Holtan,
thanks for having me again, Randy. Glad to be here.
Now, I know you brought a lot of photos, so we'll get to as many of those as possible.
Okay.
But for people that don't know your practice, I guess all you do is focus on dental implants.
Right. Randy, we're implant dentists. So the focus of our practice is helping people that are suffering with either having no teeth and they're wearing dentures, or they're about to lose some teeth. And as you know, there's many different options how people can replace the teeth. And it really, it's my job to help guide them in their decisions. You know, are we going to do implants and teeth in a day, or are we going to just replace a single missing tooth in the back?
But you really are doing teeth in the same day. Or is also you say teeth tomorrow.
Right.
Is that possible?
Absolutely. There's a couple different ways that things work, but the goal of our practice, and for people that are, again, either wearing a denture or they're maybe about to be wearing a denture.
Like headed to denture.
Headed to dentures is to provide them with a fixated set of teeth in one visit, okay? And that may mean they're having some teeth removed and we're replacing them with implants the same day. So when people come to us, they're really looking for options. And if they're wearing a denture, or if they're about to lose a couple remaining teeth, my goal is to get them into a fixated solution that never involves wearing a denture. And that can be accomplished in a multitude of different ways. There's some people that we're able to provide them with a provisional set of teeth that they'll wear for 12 or 14 weeks. There's other people that I can have them treated and the next day provide them with a permanent set of teeth. It really kind of depends on the patient's condition, what they want, what their schedule looks like.
So they get a full arch of teeth on the upper and the lower, supported by dental implants. And now you have a system to where, because there's a lot, look, I've had dentists on the show.
Right.
A lot of guys doing snap in, snap out. And I'm not an expert. They make it sound pretty good. You don't like the snap in, snap out.
Well,
Why?
again, snap in, snap out is an option. The problem with that is they're still wearing a denture. And I think people come to see me because they don't want to wear a denture. I know that I can keep people happy 100% of the time when they have teeth that stay in their mouth, just like they did when they were 17 or 18 years old. As soon as you fall back to having something removable, it's a psychological thing where, you know, those teeth, they're still not really theirs. And because they come in and out, there's some componentry that wears out. The teeth are more prone to breakage. And Randy, I just feel like in today's, modern era, nobody should be wearing removable teeth. And if I have a solution that works, that I can accomplish in 1 or 2 days, then why wouldn't I try to promote that to everyone if I know it's better?
And they can eat really whatever they want?
They can eat anything that they want to eat. These teeth, especially with some of the newer options that we have, like zirconium, I tell people, I think these are lifetime solutions for them.
Okay. I mean, they could eat like nuts, like raw things, like raw broccoli, a carrot with their front teeth?
Anything that they want to eat, they can eat. Now, like anything, there are some restrictions that I'd like to think would just make sense, like chewing ice and things like that. But for the most part, these teeth are more durable than the teeth that they're replacing or may have had years ago. I know how their teeth are going to look. I can already picture how I'd like their teeth to, say, follow their lip line a little nicer. Their teeth weren't showing as their denture moved up. I can reestablish proper dimensions, fill their face out, and that is really where the rubber hits the road with this stuff. It's not just a procedure. It's not just, a case. It's what does this person want? How am I going to be able to deliver it efficiently for them? And again, at the end of the road, people don't want implants. They want teeth that work and that look
that
really
don't
nice.
come in and out.
That don't come in and out of their mouth.
So no snap in, snap out.
It's not
That's
that
your opinion.
It's not that it can't be done.
Okay.
And there are some people that prefer those types of methods, and we can do them. When I know something is better, I'd like to talk about that, and that's certainly where I try to.
I don't want to put you on the defensive, and I know you want to be positive, but I told you, I have dentists that say, I don't think it can be done in one day.
Yep. All I can tell them is that it can. And
is it because of experience? That's based on their experience?
Well, don't forget, Randy, this is something that we're doing every day. Okay, and we have a lot of experience doing and working with these types of people. Again, we talk about traveling to learn this stuff. It's not that doing it in one day is just better for me. Again, it's all about the patient. If I can tell someone they only have to go through one procedure one time, as opposed to going multiple places and having it done multiple ways, I just think it's better.
Okay, good. Now, you brought some photos. What are we looking at?
I brought a bunch of photos. Again, there's lots of people that we've helped. It's hard to find the ones that we just want to show. This is a really nice gentleman who came to me who hadn't seen a dentist in years and years. And what you find with a lot of these folks is that their super high fear of the unknown. They don't know if someone's going to tell them they have to have a denture. They've talked to their parents or relatives that had one and struggle with it for years. So when they come to visit me,
they've seen you on TV a lot.
They've seen me on TV. They've seen you, and in one simple consultation visit, that again is a no-fee consultation, we'll take a free radiograph of some sorts to give me a picture of where everything is, and I can tell them that yes, I can do it. This is what it would cost, and again, all they want to hear about is the benefits. You know, what is this going to look like, and things like that. And
so this guy right here, like these teeth I'm looking at, those teeth had to go?
Randy, this gentleman was headed for a denture. He didn't want one. The reason he was hanging on to those last couple teeth is because he knew what that was like, and he didn't know how much worse a denture could be. So we were able to treat him. We were able to comfortably relax him with sedation in the office. One simple procedure, and he left the office that day with a fixed.
Let's take a look.
With a fixed set of teeth, and you can see what he looks like. You can just see it. You know, look at his eyes. Look at his smile. He's showing more teeth there, and certainly he's happy with the result. Every time he comes in, he thinks we did the greatest job in the world. Randy, when you look at the before and after side by side, you know, it doesn't take a dentist to see that there's problems with the teeth. He's maybe not happy with his smile. He's not comfortable, you know, really showing everything he has. And when you look at him after, I mean, this is a good-looking guy. And
it does add to the attractiveness.
It adds to the attractiveness, the appeal, and certainly he's more confident going in public and doing the same things that we like to do. I have another gal here. This lady came to me after going and searching out multiple different other types of dental specialists who all told her there was only one way to have it done, and that she had to have her teeth removed, she had to wear a denture for 6 months to a year, she had to have costly, expensive, and painful bone grafts. And she came to me after going through that and really didn't believe I could do what I said. And
like in one day?
Like in one day.
Because they saw you on TV and they come in skeptical still.
Yep.
Is that right?
Comfortably relaxed with sedation, teeth out, implants in, fixed teeth the second day. If you see her after results, this is just one of the most transformative people I've been able to help. She just lights up. Gorgeous smile, just a wonderful change for someone that, you know, is certainly more healthy as well. This gentleman here, as you can see, younger guy, lots of teeth problems. Again, didn't know what to do. Where do I go?
So he was headed for dentures.
He was headed for dentures. He actually saw one of our previous programs. He saw some of the things that we were able to do. Again, same thing. Can it be me? Can you help me like you've helped those other people? And we were able to comfortably relax him with IV sedation, and all the work was done in one day. If you can see from the final, you know, again, we talk about pretty smiles, transformation, the way he lives. Honestly, for this gentleman, I think the most important benefit is he was able to eat again. And he's a strong guy, he works out every day. He kept telling me, he says, you know, I haven't been able to eat any of the stuff that I want to eat in years because I just had another tooth problem, another this, another that. And I was so afraid of what dentures would be like.
I know a couple of denture wearers. They never complain. Are you saying there's no such thing as a happy denture wearer?
Well, Randy, a lot of people have just adapted. And don't forget, they don't even know that this is an opportunity for them. Their dentist may not have talked about dental implants or talked about another solution. So if that's all that they thought dentistry could offer them, that's what they're willing to deal with. And how do they know that there's not a better solution, that feels better, that looks better?
So denture wearers don't go to the dentist, number one, right? So
most denture wearers have been forgotten by dentistry. They don't go back to see the dentist anymore.
No reason, right?
And they don't think there's another solution.
We have time for a few more photos.
Absolutely. Randy, this beautiful lady is a former dental assistant, and she came to me and she'd seen some of our program stuff. She'd looked me up on the internet, and she was sick and tired of having all her dentistry fail. She had some beautiful crowns done years and years ago. She had begun to lose some of the back teeth, and now the tipping point was a nice bridge that was relatively recently done was lost. And again, oh my gosh, I'm a dental assistant. I heard people complain about dentures when I worked in practices. Is that what I have to do? Is that the only place I can go? So Randy, here's her final picture. And as you can see, you have no idea that those aren't veneers or someone did a nice job with crowns. They look natural, although they are white and they're pretty. And I think for someone like her, if you put her before and after up next to each other, don't tell me she doesn't look 15 years younger.
Yeah. Well,
So
she looks more attractive for sure.
she looks definitely more attractive, and you can see it in her smile. She's a really beautiful lady. Randy, do I have time for one
Sure,
more?
one more.
So this is a really nice gal, Beverly. She came to me because her son works in dentistry, and he had told her, "Mom, dentures are not for you. It's something we want to stay away from." She was losing some teeth. They become to be a little loose. And I was able to treat her with fixed teeth in a day, as you can see here. She was blown away that the process could be done in one day, that she didn't have to wear a denture even in the interim, and that the teeth looked and felt better than the teeth she had before. So she immediately resumed all her old eating habits. She never missed a day off hanging out with her friends and things. And I think it really changed her life. And you can see that she had actually told me she wanted to be included in your program because she wanted other people to know that even at 75 years old, this was something that she couldn't have done without. So people come to me all the time and ask me, Dr. Holtan, am I too old for this? Have you helped someone that's older than me?
How old can you be?
People can be as old as they can be.
Like your oldest patient?
Into their 90s.
Really?
Absolutely.
Why would they want to do this?
Well, the question is, why would you not want to do it? If you're 90 years old and all of a sudden you lose all your ability to chew, to smile, to go out in public and do those things, are you willing to give that up? And, again, it's a decision for people to make, but I think the decision is relatively clear.
Now, we should mention, because we get a lot of emails about this. Now, Medicare, Medicaid does not cover dental implants here in the U.S.
Right.
And most insurance, even if you have the best insurance, doesn't cover the whole procedure.
Yeah. Unfortunately, insurance wasn't really created to help people solve these types of larger problems. So one of the things that we've been able to do to help a lot of people is provide in-office financing. And like I tell people, if there's a way that we can make this work for you, I'll always be willing to do it, because you see, obviously, the types of things it can help people with.
Final message, somebody watching this, they're still skeptical.
What I would do is I'd invite them to come in and meet us and come for a free consultation. In one simple 30-minute visit, I can give them ideas about, if I can help them, what it would cost, time frames and things, and then we just get the conversation started.
Okay, good. I want to thank you for coming on the show.
Hey,
Always
thanks,
a pleasure.
Randy.
Thanks for coming back. You've been watching The Wellness Hour. We'll be right back.
Nobody should be wearing a denture. With a permanent set of teeth, people can now eat the foods they haven't dreamed of eating in years.
Guess I didn't realize how much I used to put my hand over my mouth. There was absolutely no pain involved whatsoever. I came in, and next thing I knew, I had beautiful teeth. So
I highly recommend. It's the best thing I ever did. There's no pain.
Call us for a free consultation today and get the smile you've always dreamed about.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. In fact, according to my first guest, you could walk into his office on any given day, walk in without teeth, and you walk out with a fixed set of teeth in your mouth, a full arch of teeth. With us, we have an expert on this topic, Dr. Matthew Holtan.
Thanks
Dr.
for having me,
Holtan.
Randy. Happy to be here.
That's not an exaggeration. Is that correct?
It happens every day.
Is that
happens
right?
every day.
Every day you're doing these procedures?
Yep. Dr. Molzan and I have developed a technique based on some of the really progressive things happening in the implant industry, and the same-day teeth treatment concept is well vetted. It works.
Okay, good. And for people that don't know your practice, and we've had you on the program before,
Yep.
You focus your efforts on sedation dentistry and dental implants for
Yes.
denture wearers or for anybody missing teeth.
Yep.
Tell me about that. I mean, who's the typical patient? Like, what's your day like?
Well, we really call it restorative dentistry because we're restoring people's smiles and we're restoring, people's mouths back to where they used to be. So we don't have a typical patient. We have lots of people that come that are missing one tooth. And what we're able to do is in one visit, remove a bad tooth and put a new, obviously artificial tooth root in, and sometimes give them a fake tooth. There are other folks that have had bigger problems. They've gone longer without dental care, and we have to remove all their teeth.
Okay.
Or if they're a dentulous, we're able to replace all their teeth in one day. So our goal is.
This book, you even have a book. It says Teeth in One Day with Dental Implants.
And the book details a little bit about our process, but it gives
his,
patients that have never heard about this a way to find out what this stuff is about. And there's so much out there in the media and in false advertising about what can work for patients. We kind of wanted to publish the book to set the record straight.
Okay.
And talk about what we can do.
Are there a lot of people, and I know you brought photos, we'll get to those photos, but are there a lot of people where you live within an hour of the practice? Like, what are some numbers? How many people have an upper or lower denture? estimate?
And again, it's hard to say.
Thousands?
I'm basing this on my experiences, but we know that there's over 60 million people in America that are losing, that have lost all their teeth in their whole mouth. Okay, so it's a huge population of people. Based on where we work, there's a higher percentage of those people because it's a more mature community. So every day I see new patients that either have full dentures, have dentures on one or other jaws, and they're looking for solutions. Their dentist has told them, I don't think you're an implant candidate. I don't think you can have what those people say they can do. And in our office, in one visit, in a no-fee consultation, I can do an advanced CT scan. I can look at it with the patient right in front of them and say, hey, you've got what we need. You've got the good foundation.
Yeah, but what if you're in what if you're in dentures for like 30 years? Isn't it true you don't have enough bone to do this?
That's a total misconception, and even if they've been told that before, it's probably wrong. Very, very rarely is anyone not an implant candidate. Sometimes you have to do the work.
Have you ever had to turn anyone away?
We really
because
haven't.
they didn't have enough bone?
Randy, there's always a solution for people, and what I think someone needs might not be what direction they want to go, but whether it is a denture, whether it's a couple implants to support a snap-in, snap-out denture, or whether it's more to support teeth that stay in their mouth, there's always a direction we can take people that can help them, and that's the goal.
So no more dentures, no more traditional dentures.
No more dentures. The goal is always that in the main visit, the visit where we sedate the patient and do most of the work, that we're able to provide them with teeth that stay in their mouth, that they can smile and function with that day.
So the day of the surgical procedure, you put on this full arch of teeth that don't come in and out, and then they leave the same day.
Absolutely.
Because other places, and I have to be careful, people need to know, I'm not endorsing you.
Right.
But how it's normally done is they put the implants in, they let them sit in the mouth for 4 to 6 months. Then they come back and put the teeth on.
And sometimes it
How
takes
are you
longer.
able to do it this way?
Yep. So this is a progressive technology. It's not something that everyone is out there learning in dental school. We've spent a lot of time kind of traversing the country, figuring this stuff out. There's a more advanced implant that we use to do it. You have to have
you teach other dentists this procedure, this same day procedure. Is that right?
Dr. Molzen and I have helped a lot of people learn this particular protocol, but the research is there. They've been doing it in Europe for almost 30 years.
Okay.
And, the goal is always to get people teeth that stay in their mouth day one. Nobody wants to wear a denture. If they have a denture, they don't want to wear it anymore. They know how bad it can be. So we're able to uncover their palate and give them teeth, again, that they can chew with that day.
So I understand this correctly because I talked to Dr. Molzen. So this all-on-4 procedure, you call it, that's 4 implants, get a full arch of teeth that don't come in and out.
Correct.
Same day.
Same day.
Okay. Now you brought some photos.
I brought
what
some
are we
photos.
looking at?
These are some people that we've helped with the procedure. Susan is a really unique woman. She has just such a pretty, revealing smile, and she hadn't been smiling.
She looks like a happy
She was afraid to smile. She had trained herself not to smile. So we talked, we went over the options. She didn't want to be in a full denture, right? And in one visit, we were able to take her from that picture you just saw to this. And her smile is contagious. The amount of confidence that she has when we talk and speak, it's just worlds different than when I first met her. And people just don't know what they're a candidate for. So again, by coming in and talking, we kind of got and figured out what she really wanted. And as you can see from her smile, the results, tell 1,000 worlds.
And you're big on sedation. So
Yes.
these people comfortably, they go in, they don't feel, there's no pain during the procedure.
There's no pain during the procedure.
What about pain afterwards? Because it seems very painful.
Yeah, and all this stuff, again, when you don't know, you don't understand. But these people, a lot of the times, have worn dentures. So they had something kind of pushing on their gum tissue that was always causing them some problems. And the beautiful thing about same-day teeth or all-on-4 is that the implants support the teeth. There's no more pressure on your gum tissue.
Okay.
So the day they walk out of there, they're chewing on their teeth, right? And the bones support the bite. So,
some people have more pain than others, but are there some people that say this didn't hurt at all?
As a rule, this procedure has an extremely low post-operative discomfort for patients, just because, again, the teeth are supported by the bone. So Randy, back up a second. Put those photos back next to each other. I want you to see something here. Don't forget, she came in because she was breaking teeth, she was missing more teeth, and she wanted just teeth in her mouth. Look at the smile, though.
She looks younger, by the way.
Even if you called that an added benefit, the smile to me makes the difference here because, I'd have to say she looks at least 10 years younger.
I think everybody would agree with that.
Yep.
Did they say that? Did they smile more, or do they give you their eating stories? What do they do?
You really see it in their eyes. people approach you with more confidence. The smile is a lot easier to get out of them. You don't have to crack a joke. They look at you and they're just excited that they were able to have this done. So it's exciting for us. It provides us with a lot of satisfaction.
Is it frustrating for some people, like they say, I should have done this years ago, or why didn't anybody else tell me about this?
A lot of these people,
does that happen?
A lot of these people have been like this for a really long time. And again, they just don't know. Again, someone told them they couldn't have this done. They weren't a candidate. What he says he can do, he can't do. And again, we have the results. We have the data. It just works.
You've been on my show before.
I've been here before.
You've had people see you on the program. And do they still come in skeptical, like not believing it's possible?
Most people don't know how to apply the things we talk about here to their particular situation.
Okay.
So the reason that we offer the free consultation, the reason we're willing to sit down with people and just talk about their particular
Doesn't everybody
situation,
offer a free consultation?
I don't think so. I think a lot of the people want to charge you for the x-rays, they want to charge you for the CT scans.
Well, that's good.
Right?
Good.
And Dr. Molzen and I feel that just by giving a little, right, spending the time, diagnosing the condition, goes a long ways in kind of developing a relationship with the patient. And really they have to trust me. They have to believe in the plan. If they don't believe in the plan, then I don't want to help them because, we're doing this to change lives. And
Good.
Everybody has to be on board with the plan. Randy, we got another patient here. Again, I could go on for hours with folks like this. This woman was missing a couple teeth in the front and a lot of teeth in the back. She'd had lots of issues. So the scenario was you could do a more traditional method, which would take maybe 1 or 2 years, put the implants in, have to do some isolated bone grafting and some things like that. But because we were able to treat her with the all-on-4 concept.
All-on-4 meaning 4 implants and a whole set of teeth.
The same day.
Like a full arch of teeth.
The same day. So we were able to sedate her, take out any of the bad teeth, replace those with the false anchors, the implants. And again, that day you can see the results. This is the day of surgery. This isn't a post-op, months later.
Very nice.
This is that day. So you can imagine, Randy, put this in perspective. They come to see me looking like this. They just don't know what we can do to help them.
They're probably prejudged as well.
Absolutely. They've stopped smiling. They've stopped going out to dinner. They don't know where they can go to have this problem solved. And again, this is day one. This is not, some.
So she would have had to have dentures.
Absolutely, that was the next step. She was going to a full denture.
Because nobody wants dentures.
Nobody wants a denture, and doesn't mean it doesn't work for some people. And that sometimes we have to kind of, bridge the gap. We have lots of folks that we've treated one jaw, we've had them in a denture in the other jaw, waiting for things to develop, and we're able to treat them. They've got a full mouth of fixed teeth. So I've got another wonderful.
You like
lady
this stuff, by the way. I'm picking up on it. It's like you're showing me baby pictures here.
Again, like we've talked about this before, doing a filling isn't changing someone's life. Almost every one of these patients here, there's waterfalls, there's tears when they get the mirror at the end of the surgery, and they just can't believe it could be done. So it's a unique service, and again, the results are speaking for themselves.
That's a young woman right here.
This is a relatively young woman who had lots of dental work done. She'd lost confidence in dentists. She just had some stuff fixed a couple years ago, and as you can see, her smile has really broken down. So Randy, the next step was dentures, and she'd already been told she had a plan to have the teeth removed and go into full dentures. And she wasn't proceeding with that because she couldn't physically get herself to that office to have it done. She was so afraid. So we talked, went through options, and again, the results here I think are probably the most transformational that I've had in my entire career. The beam that she had on her face when she came to the office for the post-operative visits was just contagious. All the girls in the office, they were crying when they saw her. They loved it. So she's incredible. I've got one more gentleman here. Again,
what's going on here?
A long-term denture wearer. He'd had upper and lower dentures. He'd been told that he didn't have the foundation to
Those teeth look pretty good.
The teeth didn't look bad. They were in the right position, but Randy, he couldn't chew. This is what this guy cares about. He didn't mind, having a smile that might not be perfect, but his wife and him told me they couldn't go to dinner anywhere anymore. And he just couldn't tolerate being anywhere with his teeth in his mouth. So what good are they to him if he's wearing them in his pocket? Okay,
good point.
So in one visit, we were able to fixate the upper and lower teeth to the jawbones, in a very healthy, functional, long-lasting way. The byproduct, of course, is a nicer smile. But again, he was out to dinner the next night. All right, so it's
and they look like natural teeth. So there's a cosmetic component to this.
That's always the goal, to make them look very natural. There's some people that want me to make them really, really white, and I'm okay with that if they're okay with that.
He looks like he might be a big guy. Okay, so could he eat, let's say, when everything's healed up, he could bite into a steak or whatever,
There-
or he has to be careful a little bit?
There's nothing that's off limits. During the transitional period, when they've had the fixed teeth, before I'm able to put the permanent teeth on, I just ask that they can eat anything. They can turn a fork sideways and chew. And as you and I both know,
But when it's all done, could they eat a carrot?
they can eat anything. They can chew ice.
Really?
Yep. These teeth are strong.
They could chew
These
ice.
teeth are strong. I don't recommend it, but I know they do it. I know they do it.
Okay, great. Well, look, we are out of time.
Okay.
I want to thank you for coming in. And all of these patients, you say all of them are sedated.
Everybody, for this particular procedure, we like to sedate. I want people comfortable. I want it to do it one time, have it be a good experience, and again, have them smiling at the end of the procedure.
So I want to thank you for coming to the show.
for
Always a
having me, Randy.
pleasure.
It's my
Thanks
pleasure.
for coming back. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.